Early signs and symptoms. You must watch out for blood cancer. Blood cancer is a type of cancer that starts in the blood cells. There are many different types of blood cancer, but all of them involve the production of abnormal blood cells. Blood cancer cells can crowd out healthy blood cells, making it difficult for the body to function properly. Early signs and symptoms of blood cancer can be vague and nonspecific, which is why it is important to be aware of them and to see a doctor if you experience any of them. Some common early signs and symptoms of blood cancer include fatigue. This is one of the most common symptoms of blood cancer, and it can be caused by a number of factors, including anemia, low platelet counts, and the buildup of cancer cells in the bone marrow. Easy bruising and bleeding. This can be caused by a low platelet count, which makes it difficult for the blood to clot. Frequent infections. This can be caused by a low white blood cell count, which makes it difficult for the body to fight off infection. Unexplained weight loss. This can be caused by a number of factors, including the buildup of cancer cells in the body, the effects of cancer treatment, and changes in appetite. Night sweats. These are heavy sweats that occur at night, and they can be caused by a number of factors, including fever, infection, and certain types of cancer. Swollen lymph nodes. Lymph nodes are small, bean-shaped glands that help the body fight infection. When they become swollen, it can be a sign of infection, inflammation, or cancer. Other possible symptoms of blood cancer include shortness of breath, easy bleeding gums, pale skin, headaches, bone pain, abdominal pain. If you experience any of these symptoms, it is important to see a doctor right away. While they may not be caused by blood cancer, it is important to rule out other serious medical conditions. Who is at risk for blood cancer? Anyone can develop blood cancer, but there are certain factors that can increase your risk, including age. Blood cancer is more common in older adults, but it can occur at any age. Family history. If you have a family history of blood cancer, you are at increased risk. Exposure to radiation. Exposure to high levels of radiation, such as from an atomic bomb or nuclear power plant accident, can increase the risk of blood cancer. Certain chemicals. Exposure to certain chemicals, such as benzene and formaldehyde, can increase the risk of blood cancer. How is blood cancer diagnosed? If you experience any of the symptoms of blood cancer, your doctor will likely start by asking you about your medical history and symptoms. They will also perform a physical exam. If your doctor suspects that you may have blood cancer, they may order a number of tests, including blood tests. These tests can be used to check the number and types of blood cells in your blood. Bone marrow biopsy. This is a procedure in which a small sample of bone marrow is removed and examined under a microscope. Imaging tests. These tests, such as X-rays, CT scans, and MRI scans, can be used to look for cancer cells in the body. How is blood cancer treated? Treatment for blood cancer depends on the type of cancer and the stage of the disease. Common treatments for blood cancer include chemotherapy. Chemotherapy is a type of drug therapy that kills cancer cells. Radiation therapy. Radiation therapy uses high-energy radiation to kill cancer cells. Stem cell transplant. A stem cell transplant is a procedure in which healthy stem cells are transplanted into the body to replace diseased stem cells. Targeted therapy. Targeted therapy drugs are designed to attack specific cancer cells. Prognosis for blood cancer. The prognosis for blood cancer varies depending on the type of cancer and the stage of the disease. Some types of blood cancer are very treatable, while others are more difficult to treat. If you have blood cancer, it is important to work closely with your doctor to develop a treatment plan that is right for you. With the right treatment, many people with blood cancer can live long and healthy lives. Here are some additional tips for people with blood cancer. Get regular checkups and blood tests. Be aware of the signs and symptoms of infection, and see a doctor right away if you experience any of them. Eat a healthy diet and get regular exercise. Get enough rest. Avoid smoking and excessive alcohol consumption. If you or someone you know has been diagnosed with blood cancer, there are a number of resources available to help you. the Leukemia and Lymphoma Society. Thank you for watching our videos. Please like and subscribe our channel for more interesting and informative videos.